भोलानाथ का ब्रश कटर एक बैटरी से चलने वाली मशीन है जिसका चार्जिंग समय 3.5 घंटे है। इसे हम 6 से 8 घंटे बिना रुके चला सकते हैं। एक बार चार्ज करने पर ये 16,000 स्क्वायर फीट गेहूं, चावल, बजरा, जोवर के खेत काट सकता है, जबकि इसी कार्य को पेट्रोल ब्रश कटर 1,000 रुपए पेट्रोल का खर्चा करता है।
गुड इवनिंग एवरीवन, सभी को नमस्ते। वेलकम टू माय डॉक्टर्स डायलॉग सीरीज। माई सेल्फ डॉक्टर गायत्री पंडितराव, आई एम होम्योपैथिक फिजिशियन फ्रॉम पुणे। और ये जो डॉक्टर्स डायलॉग यानी संवाद श्रृंखला जो शुरू हुई है, तो इसमें मैं डॉक्टर्स, रिसर्चर्स, हेल्थ केयर प्रोफेशनल्स को एज गेस्ट स्पीकर्स बुलाती हूँ एंड दे कम हियर ऑन दिस प्लेटफॉर्म एंड शेयर देयर कंसर्न्स, व्यूज which are related to health. ये मैं sessions on behalf as well as in collaboration, you can say I'm doing it with UHO, that is Universal Health Organization, as well as Awaken India Movement. तो यहाँ पे वेबसाइट की लिंक्स हम शेयर कर रहे हैं स्क्रीन पे. You can go to the website links awakenindiamovement.com and UHO, that is Universal Health Organization. जिन लोगों ने पहले के सेशंस लाइव मिस किए हैं, तो यू कैन ऑलवेज गो टू क्यूवाइव, अवेकन इंडिया मूवमेंट एज वेल एज यूएचओ के यूट्यूब एंड फेसबुक चैनल्स पे. वहां पे आपको प्रीवियस सेशंस देखने को मिलेंगे. सो टुडे इज आवर 23rd सेशन. तो फर्स्ट लेट मी फर्स्ट इंट्रोड्यूस आवर गेस्ट स्पीकर. Our guest speaker for today's session is Dr. Ravikant Singh.
Hello ma'am, how are you?
Yes, fine. Thanks sir. Welcome. Ravikant Singh, इन्होंने MBBS किया है and his specialization is MS ENT. That is ear, nose, throat. जिनको मालूम नहीं है what is ENT मैं बोल रही हूँ. And head neck surgery इन्होंने दिल्ली से ये किए हैं and he has done his diploma in hospital management from Chennai. He is a founder of Apex ENT Hospital and Trauma Care Center in Haryana. Welcome, sir.
Thank you so much. Thank you so much for inviting.
Yes. सभी को आज का टॉपिक मालूम है. आज का टॉपिक है रेस्पिरेटरी एलर्जीज, कस्टमाइज्ड ट्रीटमेंट, मैनेजमेंट एंड क्योर. भले ही ये टॉपिक रेस्पिरेटरी एलर्जीज लिखा है, ऑफ कोर्स हम इसके बारे में तो ज्यादा बात करेंगे ही, लेकिन इसके साथ कुछ इम्पोर्टेंट मुद्दों पे भी हम चर्चा करेंगे जो फिलहाल ही 2-3 साल पहले से हुई है हमारे साथ एज रिगार्ड्स टू आवर हेल्थ. तो वेलकम सर. सो लेट्स स्टार्ट आवर सेशन. सो आई विल फर्स्ट रिक्वेस्ट यू कि आप एकदम सिंपल में सभी को पहले समझाएं कि व्हाट इज एग्जैक्टली एन एलर्जी.
Thank you so much, ma'am, for giving this question. It's a very basic question. Allergy हमारे शरीर में 2 तरह के संक्रमण होते हैं, जिनको हम ग्रॉसली पहले संक्रमण को एलर्जी बोलते हैं, पहले संक्रमण को इन्फेक्शन बोलते हैं और दूसरे संक्रमण को हम एलर्जी बोलते हैं. इन्फेक्शन एक जीवित प्राणी जैसे बैक्टीरिया, वायरस, फंगस, प्रोटोजोअन, एमीबा, इनके बॉडी में इन्वेजन से या बॉडी में इनके घुसने से और एक तरह का एक आईजीएम इम्यूनिटी और आईजीजी इम्यूनिटी और एंटीबॉडीज जनरेट होके इनसे जो कंप्लेंट्स पेशेंट को होती हैं वो होती है बुखार, शरीर में दर्द और सिस्टमिक कंप्लेंट, जैसे पेट में हुआ तो पेट में दर्द, छाती में हुआ तो सांस लेने में दिक्कत, छाती में पानी होना, छाती में दर्द. तो ये जीवित पार्टिकल से लड़ने के लिए जो हमारी इम्यूनिटी वर्क करती है उसको बोलते हैं इन्फेक्शन. अगर कोई हार्मलेस पार्टिकल जो जीवित भी नहीं है, जैसे डस्ट माइट, पोलन, डैंडर और कोई फूड पार्टिकल, ये हमारे लिए नुकसानदायक नहीं है, लेकिन हमारी जो प्रिमिटिव इम्यून सिस्टम है इनको आइडेंटिफाई करती है एज थ्रेट. ये फॉल्सली आइडेंटिफाई करती है, मतलब ये थ्रेट नहीं है, लेकिन हमारी बॉडी में जब ये नॉन लिविंग पार्टिकल एंटर करते हैं तो एक एलर्जिक इम्यूनिटी, जिसको हम आईजीई बेस्ड इम्यूनिटी, जिसमें इम्यूनोग्लोबुलिन ई होता है, इम्यूनोग्लोबुलिन जी और एम तो हमारे इन्फेक्शन में होता है, इसमें इम्यूनोग्लोबुलिन ई होता है, उसका एक जो सिम्टम कैस्केड है वो चालू हो जाता है। क्योंकि ये जो इन्वेजन है या तो ये नाक के रास्ते से जाएगा या ये मुंह के रास्ते से जाएगा, तो सिम्टम उस तरह से ही होंगे कि जो नाक के होना, आई गॉट इट,
या सब नेटवर्क इशू।
नो नोटिफिकेशन इज ब्लॉक्ड, कॉल इज कमिंग। तो इस तरह से नाक के जो सिम्टम्स हैं वो नाक से पानी आना, नाक सफी होना, नाक में खुजली होना, और ये सिम्टम्स चढ़ के आंख में भी, आंख में खुजली होना, सफी होना। उस तरह से अगर फूड एलर्जी है तो गैस्ट्रिक अपसेट होना, जैसे कुछ डायरिया होना, कुछ कभी कॉन्स्टिपेशन होना, या फूड एलर्जी से स्किन के मैनिफेस्टेशन होना, स्किन में खुजली होना। तो इस तरह से हमारी बॉडी इन हार्मलेस ऑर्गेनिजम्स को, ऑर्गेनिज्म भी नहीं बोलते, हार्मलेस पार्टिकल्स को फॉल्सली आइडेंटिफाई करती है कि ये थ्रेट है बॉडी में, लेकिन ये थ्रेट नहीं है बॉडी में। ये हमारा पुराना जो लिम्बिक सिस्टम है उसकी इम्यूनिटी से चला आ रहा है। तो ये उस तरह का है कि इट इज ए एबनॉर्मल रिस्पॉन्स, एक बॉडी का एबनॉर्मल रिस्पॉन्स टू अ थिंग विच इज नॉट अ थ्रेट। तो जितने भी अब हम बात करेंगे आगे, वो सब इस इम्यूनिटी या आईजी इम्यूनिटी के आफ्टर इफेक्ट के बारे में हम आगे बात करें। सिंपल वे में, allergy is a reaction of body to a particle which is not a threat, but still the body reacts.
Right. So ये easy तौर पे अगर explain और करना है तो it's just an overreaction that you can say, isn't it, to जो harmful substances नहीं है उनको। तो ऐसे तो बहुत allergens रहते हैं, seasonal allergies भी बहुत common रहती हैं। So usually जिसको हम hay fever कहते हैं। So about seasonal allergies, sir, आपका क्या आप क्या बताएंगे इस पे? हेलो सर।
Is called as
Meenakshi, is there an issue with me or what? Network issue?
Madam, it is problem with me. I got it, but I am not understanding. Okay. Notifications are.
Yes, so I was asking about the seasonal allergies.
Blocked till the call is coming.
Yeah, so I was asking about, sir, seasonal allergies. What will you say about it?
Ma'am, the concept of seasonal allergy, it has been gone down. We don't have now seasonal allergy. We have our classification as intermittent allergy or persistent allergy. Intermittent can be, like you can say, it is seasonal allergy, but it is not now classified as seasonal or perennial. It is classified as intermittent or persistent. Seasonal allergy are usually, इसमें जो culprit है वो pollen grain, pollen particles होते हैं जो एक पर्टिकुलर सीजन में ग्रो करेंगे और एक पर्टिकुलर सीजन में इफेक्ट करेंगे। हमारे जो ट्रीज है और नॉन फ्लावरिंग प्लांट है वो एक पोलन थ्रो करते हैं और वो सीजनल एलर्जी को करते हैं, यूजुअली फरवरी, मार्च एंड सितंबर, अक्टूबर। दैट आर दी सीजन व्हिच एक्चुअली हैव दिस पोलन एलर्जी इन आवर बॉडी।
राइट। और अगर किसी को एलर्जी रेस्पिरेटरी ट्रैक्ट रिलेटेड हो ही गई तो आप सिम्टम्स क्या बताएंगे? व्हाट इज द वास्ट व्हाट यू से स्कोप ऑफ सिम्टम्स क्या?
Ma'am, if we go from up, that means nose to the lower airway, then the symptoms start like कि नाक से पानी आना, छींके आना, नाक सफी होना, नाक ऑब्स्ट्रक्ट होना, गले में कुछ खुजली होना, अपर पैलेट, तालू बोलते हैं, अपर पैलेट में खुजली होना, ये तो नाक की एलर्जी के सिम्टम्स है। एक जैसे जैसे हम नीचे आते जाएं तो जो एक एलर्जी जो लंग्स में होती है, जिसका नाम ब्रोंकियल अस्थमा या एलर्जिक अस्थमा जिसका नाम है, तो उसमें सांस की तकलीफ होना और चेस्ट टाइटनेस होना, इस तरह के फीचर्स होते हैं। इन सब एलर्जीज में बुखार और दर्द का कोई स्कोप नहीं। अगर बुखार और दर्द हो रहा है तो या तो वो इन्फेक्शन है या एलर्जी के ऊपर सुपर इम्पोज इन्फेक्शन। नाक की एलर्जी के साथ आंख की एलर्जी बहुत कॉमन है, चेहरे की स्किन की एलर्जी बहुत कॉमन है, जिसमें नाक में खुजली, आंख में खुजली होना, आंख से पानी आना, आंख लाल होना, ये भी आईजीई मीडिएटेड रिस्पॉन्स है। प्लस एक तरह का आंख के नीचे काले धब्बे आना, वो भी एक एलर्जी का एक रिस्पॉन्स। तो अगर आंख के नीचे किसी को हम चेहरे में देख रहे हैं, आंख के नीचे काले सर्कल्स पड़े हुए हैं, एक बात है कि हो सकता है वो खुजा रहा हो सकता है वो नींद ना आ रही हो, लेकिन वी कैन मेक आउट फ्रॉम ए डिस्टेंस कि हाँ ये बंदा एलर्जी से सफर।
ओके,
दीज आर एलर्जिक स्टैंडर्ड्स।
राइट। बट सर, जैसे आपने पहले बोला कि इट कैन बी वेरियस थिंग्स लाइक वायरसेस या बैक्टीरियल इन्फेक्शंस भी होते हैं। नाउ सिंस यू आर एन ईएनटी स्पेशलिस्ट, मुझे ये डिस्कशन थोड़ा इसके ऊपर भी लाना है कि जब हम ये सिम्टम्स के बारे में बोलते हैं, सो इफ यू कंसिडर वायरस या बैक्टीरियल इन्फेक्शन हो, द मोस्ट कॉमन वी नो दैट इज स्ट्रेप्टोकोकल इन्फेक्शन जो थ्रोट में होता है, पीपल हैव टॉन्सिलाइटिस एंड ऑल दो स्टफ। तो ये जो कभी कभी बहुत कॉमन प्रेजेंटेशन होता है पेशेंट का, तो ऐसा हाउ कैन वन डिफरेंशिएट? व्हाई आई एम आस्किंग दिस इज क्योंकि कोविड अगर आपने देखा होगा तो देयर वाज वेरी मच सिमिलैरिटी, व्हाट यू कैन से, और रिजेम्बलेंस to the symptomatic picture. So how can you differentiate that? Sometimes ऐसा possibility हो सकता था क्या कि there is a very common viral infection, it is not COVID, but because of the जो माहौल था तभी, तो कभी कभी फिजिशियन हो या it could have been misdiagnosed. ऐसा, what do you think about this picture presentation? That is what I want to ask.
इट वॉज अ मिसडायग्नोज थिंग। हमेशा मिसडायग्नोसिस 2 साल रही है। किसी को भी छींक आ गई, किसी को भी जुकाम लग गया और उसको कोविड हो गया। तो टू डिफरेंशिएट दैट अगर हम रेट्रोस्पेक्टिवली डिफरेंशिएट करते हैं, क्योंकि कोविड वाज न्यू थिंग एंड इट वाज लाइक कि क्या होगा क्या नहीं होगा, लॉट ऑफ थिंग्स केम आफ्टर ए वाइल। कोविड जब हो चुका था, तो अगर किसी को इचिंग है, नेजल डिस्चार्ज है, नेजल स्टफीनेस है, नेजल ब्लॉकेज है, तो ये चारों ओवरलैपिंग सिम्टम्स है। कोविड हो सकता है, एलर्जिक राइनाइटिस होता है। लेकिन अगर किसी को ये चारों चीज हैं और उसकी हिस्ट्री रही है पहले से, तो आप मान के चलिए हम एलर्जिक राइनाइटिस से डील कर रहे हैं और उसका कोई एक्सपोजर नहीं है। किसी को घर बैठे बैठे जुकाम हो गया और मतलब स्टफीनेस, डिस्चार्ज, स्नीजिंग एंड नेजल ऑब्स्ट्रक्शन, आई इचिंग, आई वाटरिंग, और उसकी पुरानी एलर्जी की हिस्ट्री रही है, तो वी कैन ग्रेटली अज्यूम दैट ही हैज नॉट सफर्ड फ्रॉम कोविड। वन मोर थिंग, एक कोविड में आया लॉस ऑफ स्मेल। एलर्जी में लॉस ऑफ स्मेल इज नॉट सडन, एंड लॉस ऑफ सडन retrospectively came out to be with the milder form of COVID. Why it is milder form, God knows, but when there is a loss of smell and loss of taste, that means you are suffering from a milder variant of COVID. The likelihood of getting into a morbidity, mortality is very remote. Fever, again, allergy has no fever, no facial pain, no sinus pain, no body ache, no weakness. तो कोविड और एलर्जिक राइनाइटिस में ये चीजें डिफरेंशिएट है। वन इज हिस्ट्री ऑफ एलर्जिक राइनाइटिस पहले से होगी। कोविड पहली बार हुआ तो कोविड हो सकता है, एक्सपोजर हुआ कोविड हो सकता है। बाकी कोविड में जो लॉस ऑफ स्मेल, सडन लॉस ऑफ स्मेल, सडन लॉस ऑफ टेस्ट, बॉडी एक, वीकनेस, लेथार्जी, गोइंग डाउन, जस्ट द फीलिंग ऑफ इल। ऑफकोर्स मेंटली भी आदमी डाउन चला जाता था कोविड में, सडनली कमजोर सा लगने लगता था, बट इट वाज नॉट लाइक दैट। So these things never had in like allergic rhinitis. अगर ये 4 चीजें एंड देयर इज नो हिस्ट्री एक्सपोजर, वन कैन इजीली से कि हाँ भाई कोविड एक्सपोजर वाज मोर प्रॉब्लम.
बहुत बार क्या हुआ था सर, इफ यू ऑल्सो विल राइटली रिमेम्बर, कि हर एक कोविड के सिम्टम को इतना इम्पोर्टेंस दिया गया उस समय दैट बहुत से पेशेंट्स कि जिनको पहले भी सर्दी खांसी जुकाम इजीली दे यूज्ड टू हैंडल देमसेल्व्स, लेकिन जैसे आपने अभी बोला कि किसी ने छींका तो भी एक डर था लोगों के बीच में. सो हर एक सिम्टम को इतना इंपॉर्टेंस दिया गया कि जैसे आपने भी बोला कि एनोस्मिया, कि आपको स्मेल चली गई तो लोगों को थोड़ा स्मेल चली गई, भले ही उनको कुछ बाकी के सिम्टम्स नहीं हो, फिर भी वो खुद जाके दे यूज्ड टू गो एंड टेस्ट एंड दे यूज्ड टू फील आइसोलेट देमसेल्व्स. सो ये जो एग्जैगरेशन हुआ, तो इसके ऊपर आप कुछ अवेयरनेस, व्हाट यू कैन से अबाउट इट?
See, the circular which was coming from WHO, लोग उसी को follow करते थे, and it was creating havoc in some countries. न्यूज तो ऐसी आ रही थी, हालांकि वो न्यूज भी गलत थी. चाइना में हैवॉक नहीं था कोई. चाइना में हमारे फ्रेंड्स थे, कर रहे थे, they were doing medicine. उन्होंने बोला लॉकडाउन है, बट ऐसा हैवॉक नहीं है कि किसी को घर में बंद कर दिया एंड ऑल दैट, ठीक लिया तो उसको जाल में बंद कर दिया. इट वॉज नॉट लाइक दैट. इट वॉज रियली नॉट लाइक दैट. अब प्रॉब्लम तो थी बिकॉज दिस वॉज अ न्यू डिजीज. इट वॉज क्रिएटिंग हैवॉक इन दी वर्ल्ड विच वॉज क्लीन, विच वॉज नॉट इन्फेक्शियस लाइक आवर कंट्री. हमारी कंट्री तो इन्फेक्शियस कंट्री है. तो हमारी कंट्री में जो मॉर्बिडिटी और मोर्टेलिटी इज कंसिडर्ड टू बी 10 times more than what is happening in US and China, because they are better developed countries than us. और हुआ उसका उल्टा. It exactly happened opposite with us. China and US had some troubles. Actually, उनका तो जो demographic data था mortality morbidity का, that was 100 times higher than our country. If we compare the population as such. So इसमें जो circular था, which was changing the announcements were changing every day and all that. Lockdown was something which made only to discuss about COVID, only to discuss about COVID. All the mommy, aunties, uncles, they were passing on WhatsApp messages like anything. The social media was creating WhatsApp messages, interesting, tasty WhatsApp messages which can be palatable, enjoyed, and of course create fear also. See, anything what creates fear, enjoyment, or punishment or reward is a like, definitely. So it was the time when then, and it suddenly ended. People say it is the election while ending of COVID. COVID only ended when the election and all things came in and all that. And suddenly you say this is lockdown today and COVID is on the high. And after a while on this day, there is no COVID. You can take precaution, but nobody will like to take a precaution. So it is a new disease, that is true. But it is now considered to be a respiratory syncytial virus, that is all. And demographically,
yes, you continue what you were saying.
Demographically, it actually didn't create any impact, except it devastated the US healthcare system. It is not so competent. The only thing what it did is in US only. Our country had the things, true. But while we compare the mortality, morbidity data, because it has now over, it is actually not so exponentially significant as it was like without COVID, without a lockdown. That's where now you keep a camera on the this जहाँ पे दाह संस्कार होता है, अगर आप वहाँ कैमरा लगाओगे रोज, तो वहां तो होता ही ये काम है. वहां पे एक दिन बाय द वे डेड बॉडी ज्यादा हो गई कोविड से, एंड यू आर कीपिंग द सेम विजुअल्स गोइंग ऑन, कि ऊपर से ड्रोन कैमरा दिखा रहे हो, बट डेथ रेट वाज रियली नॉट दैट मच. दैट एक्चुअली वाज सस्पेक्टेड, और दैट वाज told, or that we were thinking the half of the population will go away, a significant part of the population will die and end up their life. That was not that case, which has happened. So I'll just end up saying it is now an understandable disease, and worry is there. It's a respiratory virus. Anybody can have it. Mortality depends on the underlying cause. That is all.
Sir, आप as an ENT specialist, एक इम्पोर्टेंट सवाल ऐसा मैं पूछना चाहूंगी कि बिफोर कोविड, ड्यूरिंग कोविड, तो इसमें आपको कुछ फर्क लगा क्या इन योर प्रैक्टिस, लाइक व्हेन यू यूज्ड टू सी पेशेंट्स बिफोर कोविड एंड ड्यूरिंग कोविड? So did you really find a difference of presentation of case? या आपको भी कभी ऐसा लगा कि you are understanding my question?
There is a difference. There is a difference. सबसे पहला difference मैं आपको just on the lighter tone बताता हूँ कि the first difference is the perception of the patient towards the doctor. पहले जो अब एक respect हम use कर सकते हो. The respect for doctor, एक पेशेंट मेरे को बहुत सालों से दिखा रहा है, लेकिन मैं आज सडनली देख रहा हूँ उसकी जो रिस्पेक्ट लेवल है बहुत ज्यादा हो गई। जो मेरे से लड़ता था कि मेरे को पहले देखो उसको बाद में देखो, मैं बहुत देर से खड़ा हूँ एंड ऑल दैट, ही वाज वेटिंग पेशेंटली एंड ही वाज अगेन ही विल हैव अ वर्ड कि आप लोग का भरोसा है, तो रिस्पेक्ट केम इन। वन सेकंड सुनीता, ले जाता हूँ। तो रिस्पेक्ट केम इन, so that was the thing which was there. And second, fear was always on one's face. Every time there was a fear. Every time anybody came, he had a fear. It was a fearful 1.5 years of consultation with the patient. And sometimes I felt like, why should I give medicine? Just have rest, just have water and all that. And they were, the ENT psychiatry branch developed. The psychiatry complaint related to the ENT developed rather than the pure ENT.
Pure ENT.
So it was like more of the counseling and all that. Still, the question will remain the same after half an hour of counseling. डॉक्टर साहब मेरे को तो थोड़ा खुजली हो रहा है, थोड़ा दर्द हो रहा है, थोड़ा मुझे sneezing आ रहा है. That was it. But respect has improved for doctors, and of course the Google part has come now. Google has made very faithful. Google means the social media, Google, whatever you call it, anything which is coming on your screen is a threat.
You said that Google has become a new doctor nowadays because सभी लोग Google करके they get most of the information there, और वो भी कितना correct रहती है, कभी-कभी उस पे भी doubt आता है.
See, Google is a very fearful doctor. It will actually, if you follow Google, you will label yourself with 100 diseases.
True.
That is what it is. It is not customized. It will tell all the possibilities. And the father of Google, ChatGPT, will have 1,000 possibilities.
Right.
And self-treatment is again, back for the patient. I will do self-treatment. I will get.
Now that we are talking today's topic about allergy, तो इसका diagnosis के बारे में what as a doctor you will tell patients कि how to diagnose these allergies, like खुद को क्या देखना चाहिए as a patient कि okay I might be have an allergy to some substance, so what you will say?
See, the diagnosis is 90% history. 90% history. The patient will typically tell a typical history of nasal discharge, means naak se pani aana, cheeky aana, nasal stuffiness, nasal itching over palate, not tonsil, itching over palate. Associated with eye itching and redness in the eye, maybe watering in the eye. So these are typical symptoms, and people don't realize something is going around. But when you will dig in and ask, they will relate it to something. They will say it is early morning. They will say it is late evening. They will say it is exposure. There's something like exposure. Most of the patient will say dust allergy. That the dust particle, what you see, the seen dust particle, they will say, "Wait, dust थोड़ी मेरे को allergy होगी." The dust particle, what you see, never causes allergy. They are high molecular weight particles. They get entrapped in the vibrissae of their nose, and they are not responsible for allergy. I'm telling about dust just because there is a very common myth: dust causes allergy. Dust doesn't cause allergy. The dust might cause allergy, which are microscopic particles, which is a dermatophagocyte which thrives on dead skin, dead squamous epithelium, and they reside in our textiles, kind of pillow, mattresses, holster, blanket. So these dust mites, they are the cause of allergy, not dust. Everybody says dust. It's very difficult. Dust is the problem. Dust is not the problem. Dust mite is the problem. Second myth the patient has, कि when I go in the garden, I have allergy. One who is half red, he will tell कि अरे जो flowers हैं उसके pollens होते हैं, वो मुझे allergy create करते हैं. So I'll just make a point clear. The pollens of the flower, the flowering plant pollen, they are again high molecular weight pollen. For pollination, they require honey, bees, and insects carry pollen from one part to another for pollination and flowering. These never cause allergy. Allergy from pollen is caused by non-flowering plants like grass pollen, wheat pollen, trees. So these non-flowering plants cause pollen. So never relate, because the garden contains grass also. So the pollens are coming.
हाँ, बहुत बार लोगों को लगता है कि फूलों की वजह से एलर्जी है. इट्स इम्पोर्टेंट पॉइंट. यस, राइट.
This is a myth. I just need to clear the myth. So going, making a garden at home, a kind of a balcony garden, that is not bad. Grass is the main. Grass pollen is the main culprit, and tree pollen, of course, that is the calendar. There is a pollen calendar from February, March, September, October. There is a tree, pollinating. They travel over long distances. You must have seen in some hill station. You will find a single tree. Manali. You will look down on the mountain. That will be single tree. So single tree is because they travel long distances and pollinate and produce that kind of vegetation. So these things, because these are the most two important, and the third important is the pet dander. Pet dander means you will be living with a pet for long means 2 years, 3 years, and you will suddenly say, "यार तो मेरे पास कुत्ता बहुत सालों से है, ये कैसे एलर्जी कर सकता है?" It takes a time for the dander to take its effect, and it can produce. The pet dander can produce an allergy thereof anytime. So
Sir,
these
many
are
of the patients, I have seen few patients who had come to me, they have allergy for air conditioning also. They say if cold air, inhale kiye to he starts sneezing, runny nose. I have seen couple of patients like that. So I think...
I'll tell you, that is not allergy. That is a nociceptive nerve irritability. That is not IgE mediated mechanism. That is a nerve irritability mechanism. The nerves get irritated, and the mechanism is again mastered but not IgE mediated. This is one of the non-allergic part. When AC हवा का आ रहा है, मुझे छींक आना चालू हो जाएगा. मैं गर्मी से ठंडी में जाऊंगा, मुझे छींक आना चालू हो जाएगा. It is because कि जो नर्व एसी में नहीं इरिटेट हो रहा था, वो बाहर जाने से इरिटेट हो गया, या जो नर्व बाहर नहीं इरिटेट हो रहा था, वो एसी में आने से इरिटेट. नॉर्मली बाहर से जब अंदर आते हैं तो हमें यू फील स्टफी, एंड दैट इज अ नर्व बायस्ड एलर्जी. That is one of the non-allergic causes. That is a different issue. That is not allergic rhinitis.
Okay. And sir, one more thing is कि ये जो allergen हम बात करते हैं allergen की, तो can it happen that eventually if you have a number of multiple attacks, maybe of allergic attacks, तो कुछ साल बाद can you become immune to these allergens? And there is, you see a reduction in your episodes?
Yeah, there is a tolerance over years. There is a tolerance over years, which is age controlled, hormonally controlled, and which is immunomodulation. That is there. I'll just tell you a narrative. People, or like say children with adenotonsillitis or tonsil infection or adenoid infection, there was a myth that these kids will develop more allergy, because the signs and symptoms of allergy, they are like adenotonsillitis. If it is not a fever or a pain or something like that, there is a symptom overlap. But what happens, the outcome which has been through studies, there are two T systems, T cell system, T1 cell system and T2 cell system. T2 cell systems are actually responsible for allergies and T1 cell systems are responsible for protective immunity against infection. A kind of a low socioeconomic status child who is suffering from infection will develop T1 immunity and the T2 immunity will not develop. Now, these low socioeconomic status would be harboring a lot of infection, carrying infection day in day out. They don't get allergy because their T1 system is already active, which has a protective effect on T2 system, which is the allergic system. So these better to have infection in the childhood, like more of the cleanliness. First, if you keep yourself very clean, like the high affluential societies, they keep everything clean, sanitizer, use antibiotics even with first complaint, even not so significant, or inappropriate use of antibiotics, 2 days, 3 days, and yet a come. So these things actually have an impact on producing more and more allergy in the long term. Those children who suffer from a lot of infection and exposed to a lot of infection, they don't develop it. Now this is very clear. So children should be, you get immunity not because you are immunized with vaccines. You get immunity when you are overexposed to the infection, and the infection has a counterproductive effect on the allergy. More the child will be exposed to infection, lesser and lesser allergies will develop in the later part of life, except the genetically linked.
हाँ, तो आज जो व्यूअर्स देख रहे हैं उनके लिए ये बहुत इम्पोर्टेंट बात है, बिकॉज बहुत पेरेंट्स दे फियर कि थोड़ा इन्फेक्शन हो गया, थोड़ा कुछ हो गया, so they become panicky, and like what you are saying, excessive use of antibiotics and all, it happens. So hone dena chahiye. It's good, isn't it?
Child will develop his strong immunity not by vaccine, by getting the infection. That is a narrative, and that is true. It is a narrative. It is not the absolute truth. It is just a narrative.
So that's a natural immunity that we are talking about, isn't it?
And it has a protective effect on the allergies also. A child who is getting infected more and more, you will not find allergies in low socioeconomic status. Never a low socioeconomic status person would come with allergy. If at least it is true for a child of 8 to 15 or 20 years of age. But in affluential population who lives in flat and all that, day in day out, it is 8 out of 10 children would have nasal allergies.
Right. और अगर किसी पेशेंट को रियली सीरियस दे आर रियली एलर्जिक टू सर्टेन स्पेसिफिक एलर्जन, तो उसके लिए आजकल जो आप लोग बताते हैं एलर्जी टेस्टिंग, तो इसके बारे में आप क्या बताएंगे फॉर टू डिटेक्ट स्पेसिफिक एलर्जन एज अ पॉजिटिव फैक्टर, क्या है ढूंढने के लिए?
Ma'am, allergy, the management or the diagnosis of allergy, the second armamentarium is the serum Ig level, which will only tell whether you are sensitized to allergy or not. If you are sensitized for the first time with the allergen, Ig will be elevated and it will tell that you are allergic. The gold standard test is a skin prick allergic test. There are blood allergy tests also available, which has been available for long. Skin prick test is a new entry in a few years, which has been there. But the most reliable test for at least for allergic rhinitis or airborne allergy is skin prick allergic test. Blood allergy tests are like true for drug allergies or some food allergens. But for allergic rhinitis, the gold standard is skin prick allergic test, and you just put a drop of allergen over the forearm. You do a epicutaneous scratch, not prick. It is called a skin prick test, but let me clarify. It is not a skin prick test. It is a skin scratch test. There is no prick involved because prick creates a sensation of pain that he will prick me.
Right.
बस ऐसे ना कि पेशेंट को मैंने बोला स्किन prick test कर लेते हैं आपका, So he will again say, "Sir, दर्द होगा बहुत." So actually, the now name has become skin prick, but actually that is a skin scratch test. You do a epicutaneous skin scratch at 45 degree, which will only create a feeling of touch, not more than a touch. That is all, and it is easily done in children also. And we usually test pollen, dander, dust, insect. Again, I have forgot the most important allergen is in cockroach. Female cockroach is the most potent allergen. The excreta of female cockroach, the wings of female cockroach, which is actually called dander, the secretion of sebaceous gland, saliva of female cockroach. They are potent allergens in our home. So we can find the culprit allergen by a combination of history and by a skin prick testing report and assign this allergen is culprit for you, this or this, one or two or three, and you can institute avoidance. And if doesn't prove right, you can institute immunotherapy,
सर
which is
लेकिन
called
बहुत
as
बार नहीं, बहुत बार क्या होता है कि ये एलर्जन टेस्ट में निगेटिव ही बहुत बार ऐसा होता है कि यू डोंट फाइंड एनी एलर्जन एज अ पॉजिटिव फैक्टर, तो उन केसेस में आप क्या बोलेंगे, एलर्जिक कॉज क्या हो सकता है?
Sir, man, if you don't find any allergen, then you are dealing with either, or you are dealing with a non-allergic rhinitis.
Can you
If
repeat
you
once
are
again? Can you repeat once again?
if your skin prick test, first let me just tell the first criteria of skin prick test. You have to do with a saline prick, and you have to do with a histamine prick. This is called as the screening. Suppose so histamine does not show reaction, then skin prick allergic test is not done because there is no sensitization. Even it is allergic rhinitis, there is no sensitization. You have to be sensitized to an allergen for the histamine reaction to show, which is called as flare and wheel reaction, Ruber dollar sign. And when the histamine shows a reaction, then the skin prick test is continued. It is not possible that histamine find an allergen. You will find an allergen.
ओके नहीं, मैंने ये क्यों सवाल पूछा क्योंकि लास्ट ईयर मेरे एक पहचान में ऐसे ही फ्रेंड है, उनकी बेटी को हॉस्पिटलाइज किया गया. देयर वाज एन एलर्जी, small episode of what we were talking about, ki sneezing, runny nose, and it increased to such an extent that they really felt ki we need to do an allergen test. और डॉक्टर्स ने करवाए, लेकिन वो सब उसमें कुछ भी पॉजिटिव फैक्टर नहीं निकला, इसलिए आई जस्ट फेल्ट लाइक आस्किंग कि एलर्जन डिटेक्ट ही नहीं हुआ, बट देन देयर वाज अ नीड फॉर हॉस्पिटलाइजेशन.
That is if they must have followed the. If histamine does not show anything, then the skin prick test is not performed. If histamine shows a response, then the likelihood of getting a culprit allergen is as good as 95 to 99%. Because whole of the earth is allergen. You can be allergic to anything. What we have studied and is common, we are actually, enumerating dust mite, pollen, dander, pet dander, cockroach, female cockroach, molds, wasp, something like that. We are talking about, but everything is an allergen for us. So that is how it is. And if you are supposed to not finding a culprit allergen, then you are dealing with a non-allergic rhinitis. Many causes. Gustatory rhinitis. If you will eat spicy, you will have sneezing, nasal discharge. Hormonal, you will have, in pregnancy, you will have running nose. You suffer from PCOD, you will have running nose. You suffer from something like a hormonal disorder like hypothyroidism, acromegaly.
Right. हेलो,
ग्रोथ हार्मोन आपको रिलीज होगी। I'm done.
हाँ, yes. So yes, this was about the diagnosis part. तो एक बार फिर से मैं कोविड पे आऊंगी कि ये तो एलर्जी के बारे में हमने डायग्नोस्टिक थिंग बात की, लेकिन व्हेन वी वर टॉकिंग अबाउट आरटीपीसीआर और आरटीपीसीआर करने का जो तरीका है, why I'm asking, because you are dealing with ear, nose, throat, and RT-PCR was the test which was happening in our nasal cavity. Nasopharyngeal swab lete the. So I wanted to ask you that could there have been real any complications while performing these tests? Could they have gone wrong? Could they go wrong and injure any person? What you will say?
Definitely. Initially, these ENT people were, employed to do this RT-PCR test, and they were
Because this was
required to
very
train
new test now, because this was very
Yeah.
new method, nobody knew about it. And I would say that non-trained staff was doing it. So there were many questions raised regarding the performance of bringing out this. So you tell about it. Hello? Dr. Ravikant, sir? Yes. Is it on my side? Dr. Ravi?
I'm not. It might be on my. It's not audible. Can you see me?
Okay. No, but it's freezed. Your screen is freezed. Yes.
Okay,
Now you
but
can.
I'm moving. Okay.
Huh.
See, RT-PCR is always done with a swab, and the basic technique is to go along the floor of the nose, and that they were taught that way only. There's only one option: go by the hard palate. That is the perpendicular method.
Right.
And it had led to, which was very common. It had led to bleeding,
Huh. Yes, about bleeding and even
some trauma
broken
over.
swab. Yes.
Yeah. Foreign body we have removed one foreign body actually. We had the bad fortune of removing a swab from the nose because of that RT.
Okay, so you had an experience regarding this. I think sir is having some network issue. तो हम लोग ये एलर्जीज के बारे में तो बात ही कर रहे हैं, लेकिन एलर्जीज के साथ साथ वी आर टॉकिंग अबाउट कोविड ऑल्सो, क्योंकि ये सब प्रेजेंटेशन इज वेरी मच रिलेटेड टू ईएनटी, एंड बिकॉज आज डॉक्टर रविकांत सर स्पेशलिस्ट है, ईएनटी स्पेशलिस्ट है, इसलिए मुझे आज लगा कि ये सब पे चर्चा होनी चाहिए कि आरटीपीसीआर टेस्ट करते समय भी कुछ तकलीफें आई थी। जैसे सर ने अभी एग्जाम्पल दे रहे थे सर कि उन्होंने फॉरेन बॉडी निकाला है, ऐसी भी चीजें हुई है बिकॉज ऑफ नॉन ट्रेन्ड स्टाफ की वजह से। एंड इम्पॉर्टेंट चीज भी उन्होंने बताई कि डायग्नोसिस में एलर्जन टेस्टिंग का महत्व, और जब भी रिजल्ट निगेटिव आए तो उसका क्या है। एंड वी टॉक्ड अबाउट द कॉमन सिम्टम्स कि एलर्जी के क्या होते हैं, एंड हाउ सबसे इम्पोर्टेंट बात जो सर ने आज कही है कि जब छोटे बच्चों में एलर्जी एपिसोड्स होते हैं तो डरना नहीं चाहिए, एंड द मोर यू लेट दीज चिल्ड्रन गेट एक्सपोज्ड तो उनकी इम्यूनिटी बढ़ेगी ही। तो यस, आई थिंक डॉक्टर रविकांत इज बैक. So yes, sir, I was talking about this diagnostic. This RT-PCR, you were telling something.
We had a foreign body nose. We had a foreign body nose because of the inappropriate. The people who were doing were the very lower class staff because it was a government entity then, and for doing all this tests, they would employ the lower grade, even less than nursing staff and all that. And so this was the issue. There had been training, and we had been called. The private parties have been called to train to enter anything in the nose. And if you fail this way, then what is the next way? First is the inferior turbinate way, that is perpendicular. If you fail that way, then it's between the inferior and middle turbinate. And these people were not aware of the anatomy, so and they used to go straight to the eye. They used to go
Yeah.
like this. Actually, it should be like this. This is how it is. So that was
Yes.
there, but it gradually, once you do 15 RT-PCR, 15-20, then you become accustomed to how the nasal cavity can be negotiated.
Yes. So, sir, what about the treatment about avoiding allergen? What treatment you will tell?
See, two treatment will never change. One is the avoiding the allergen trigger, that is avoidance of allergen, and alkaline saline douche. These treatment should not be step or step down. We do step up and step down. Like when symptoms are more
Second
and
one, what you said?
we
Second one, what you said? I didn't get.
the first one is allergen avoidance and second one is nasal douching. Nasal douching means cleaning with the nose, nasal rings in the nose, or alkaline saline douching. Wash your nose with saline or a alkaline saline mixture, like a mixture of soda bicarb and sodium chloride. So
Okay.
these two things should not be stopped in any allergic patient. They should continue. Like we use step down, step up. We even if self medication, हम खुद मेडिसिन ले रहे हैं तो हम कभी तो मेडिसिन लेंगे और कभी मेडिसिन हम बंद करेंगे. So that step down, step up is okay, but there should be no step down or no step up in allergen avoidance. About the gold standard, the first treatment is for kind of a mild intermittent or a mild persistent allergy is oral antihistamine. They show their effect as early as 48 hours, and we have to review again after 48 hours on the third day. If the symptoms improve, then we will, of course, continue the antihistamine for a period of 3 weeks. And if the symptoms don't improve, then we will step up. Step up means we will now use a intranasal antihistamine spray, the agilastine. Agilastine is the only patent chemical. And again, we will review after 1 week. If the symptoms increase, then we will step up to intranasal corticosteroid. If the symptoms decrease, then we will step down to intranasal agilastine. We will step down. That means we remove intranasal agilastine. Treatment, nasal douching and allergen. Nasal douching means nasal washing and allergen avoidance should not be
up or should continue with the same pace at should be. There is no step down or step up in nasal washing and allergen avoidance. Allergen avoidance and nasal washing should remain the same.
ओके सो सर ये जब आप नेजल वॉशिंग बोल रहे हैं तो मुझे एक वर्ड आया ध्यान में दैट इज जलनेति इज इट व्हाट यू आर टॉकिंग अबाउट और इट इज डिफरेंट
Jalneti is again a form of nasal washing. That is true. Jalneti, but what in allopathy we do is we do either a saline nasal washing, we do a saline plus bicarbonate, that means a alkaline nasal washing, and or third we do a saline with budicort, that is budesonide. We use 1 ampule of normal 1 ampule of budicort in saline and do nasal washing, and we can use it as a syringe. And Jalneti is something of a kind of a free flow from one nasal cavity to another or the same nasal cavity. That is, of course, difficult to learn, very difficult to learn in the initial outset. But
So nasal washing, you are saying that you use medicines into it, but Jalaneti is totally devoid of any medications. लेकिन ये
This nasal douching can be done.
हाँ, लेकिन ये जलनेति इतना यूज किया गया, you know, too over, it was used like anything. And बहुत सारे promoters भी थे तभी कि जलनेति करनी चाहिए, it will, you know, avoid you from getting COVID infection and all. So over use of this Jalaneti can also do harm to your nasal sinuses. Sometimes it can go wrong. What do you think?
See, the school of thought for Jalneti doesn't advise any wrong effects of Jalneti if it is done in that pure form how it is done. For a normal patient, Jalneti will take a long learning curve, but nasal
Yeah.
wash will take a short learning curve. A patient with severe allergic symptom, and on day one I prescribe him like nasal wash with saline or steroid nasal wash, whatever. It will be a difficult thing on day one. But after 2 hours, the amount of benefit he is going to get, he will deliberately use from day two because he knows this is better than a drug. This is better than anything, and at least now I have a sound, safe airway, which is patent. So the compliance of nasal wash or nasal douching is very low when once the patient hears it. I have to clean my nose through this, but the compliance goes significantly up after one or two episode after 1 or day or 2 or day. It is the compliance is even more better in children. Children recognize, हाँ भाई अब तो मैं बिल्कुल I have no symptoms and all that. It is true also. It's a family tested thing. My kids are also allergic, genetically allergic because the of course mother is allergic. So they do nasal wash. They rarely encounter the need of using any drug, any antihistamine or any nasal sprays and all that. So the that is what the significance is on allergen avoidance and significance is on nasal washing with saline, soda bicarb, saline combination or saline with steroid combination. These
Right.
are at least symptomatic treatment, best symptomatic treatment available in present times.
सर और एक जनरल सवाल में और एक पूछना चाहूंगी कि देर आर पेशेंट्स हु कंटिन्यूअसली यूज दीज नेजल सलाइन ड्रॉप्स और इवन फॉर ईयर इश्यूज, ईयर ड्रॉप्स. सो व्हाट आप लोगों को क्या बताएंगे इसके बारे में अबाउट दीज ड्रॉप्स इन जनरल?
So, ma'am, there are two drops, like one is saline nasal drop and another is called as a decongestant nasal drop. Usually the chemical is oxymetazoline, xylometazoline. It is like Otrivin, xylometazoline, and Otrivin S is saline nasal drop. So, cleaning with saline nasal drop does not have any addictive effect, does not have a thing called rhinitis medicamentosa, that means side effect because of a use of nasal drop. Using this xylometazoline or oxymetazoline nasal drop is not recommended more than 3 days in a row, or it is used like a kind of an emergency or a required drug whenever there is a strong, congested, stuffy nose. Then it is required. And to be very frank, our association has written to the drug authority to ban this xylometazoline compound drug. Matlab, this chemical should be banned. They have given an advisory that this cause more harm because the patient keep on using this, and now the allergy is impossible to treat because now the allergy is not that, it is rhinitis medicamentosa. That means long use of xylometazoline will produce that kind of stuffiness which will not go by any drug. Overuse of a drug. So saline nasal drop, no issues because that is only for cleaning. This is a kind of a isotonic to the body fluids. This is 0.9% saline. But xylometazoline and oxymetazoline should be used in only case of dire emergency and not beyond 3 days. Because the more you use, more you will develop a symptom that will not get relieved with any kind of medicine.
नहीं, क्या होता है ना, बहुत बार पेशेंट के पास पहले के प्रिस्क्रिप्शन रहते हैं एंड थोड़े सिम्टम्स दिख गए तो दे ओवर द काउंटर जाके खुद ही लेते हैं ये चीजें. So that is why I felt like asking you this. And what about the ear drops, like, you know, just for impacted wax and all, these are very commonly used by patients, like Solivax and all. So how far you should be using these?
Ma'am, using a Solivax, if suppose you had a consultation with doctor, you have a tendency to form more wax. Then after that approval, one can use Solivax and let it go like this. People, what they do, they use Solivax and they use every kind of weapon to clean the ear, from hairpins to anything and all that. Oh, earbud. Earbud is a thing which actually should be banned of production because they produce more harm rather than any. You push the wax more inside.
More inside.
You remove just 1% or 2% of it and try to push it more inside, because most of the patients which are encountered with this impacted wax are just because of this, cleaning the habit of cleaning with earbud pins and something like that. So the earbuds are strictly contraindicated, and of course the pins and of course any other weapon which you use should not be used for cleaning and all that. The Solivax will create its effect in matter of 15 days. Otherwise, get it clean from your doctor. That is what it is. Even you have to get it clean after a complication.
Right. Anything related to upper respiratory thing that you want to tell patients today? जो भी सुन रहे हैं कि as a ENT specialist, कुछ 4-5 points that you will like to tell patients to take care about.
See, upper respiratory thing is a kind of a infectious pathology. It is not an allergic pathology. One thing. Our country is an infectious country. Every child, 100% children suffer from adenotonsillitis at different levels. Everybody has tonsil, everybody has adenoid, because it's an infective country. Allergen avoidance or infection avoidance, that is barrier, mask, is the only way which our country doesn't have. It had only in COVID time, and before that we didn't have, and after that also we are not having. Second, the cleansing part. The cleansing part means using gargle, medicated gargle, homeopathic gargle, even tincture, mother tincture gargle, or using steam inhalation. If you don't want to use allopathic drug, kind of a Vapocab or something like that, eucalyptus steam inhalation is, of course, providing more relief than any medicated thing. So using that oral and nasal hygiene is of prime importance. And the first instance you develop a pus in adenotonsillitis, otherwise it's a pustular organ, that is the right time to institute what is called as the maximum medical treatment. No medical treatment like 4 दिन लिया 5 दिन लिया खत्म कर दिया. The maximum medical treatment of pustular adenotonsillitis is not less than 21 days of antibiotic in a row to prevent recurrence, relapse, and of course promote remissions, and also not having drug resistance. You will see the child now is okay with third generation antibiotic. Now after a few years, he is not even responsive to the first generation antibiotic, that is cefuroxime or something like that, which is the drug resistance is growing at a very fast rate. Drug resistance is so much, the drug which is used, azithromycin, is now a drug resistant thing. You hardly get azithromycin response in any kids. So azithromycin is actually clinician not preferred drug. Clinician don't prefer it because the drug resistance is very high. Earlier it was very common. Azithromycin 500 milligram once a day, 3 days, you are over. Now it is not the case. Now the maximum medical therapy, it is instituted not less than 21 days for this pustular thing. It is mostly strep throat, which is a pus in the tonsil area, base of tongue area, and the adenoid area. But these are not allergic. They will, predispose to allergy. They will increase your allergic symptoms, but they are not allergy as such. They are to be dealt separately. Allergy has to be dealt separately.
आपने अभी स्टीम इनहेलेशन की बात की, तो मुझे और एक चीज पूछनी है कि ओवर यूज ऑफ दिस स्टीम इनहेलेशन भी हुआ, तो इतना ओवर यूज हुआ कि 15-15, 20-20 मिनट के बाद दिन भर लोगों ने स्टीम इनहेलेशन किया है. I'm not talking, it's not an exaggeration, it has happened. So what is your take on this about excessive steam inhalation?
See, when you do anything aphysiological means when you use a temperature, which is actually, steam is at 100 degrees Celsius, and it is entering your nose. If at suppose so 80 degrees when you are near, then it is going to cause a thermal burn. That is how it is. You have to take the steam, not the temperature of the steam. Steam is what? Steam is a humidified air. So you have to sit at a distance to take steam so that the temperature, the thermal injury is not there. You have to only take humidified air. The best version is a humidifier. If you take a humidifier, that would be a better version. But since the homemade things are not humidifier made out of it is a steam inhalation only. So you have to do steam inhalation, but from a distance. People have used sanitizer. They have got this what is called as overdrug induced. They have spoiled their flora of the hand and getting all kind of dermatitis, fungal infection, intertrigo. A lot of things are there. People came with not COVID. People came with कि मेरे हाथ में ये dermatitis हो गया है, and the culprit came out to fungal infection. You destroy your flora. It has to be cleaned, but it doesn't have to be cleaned vigorously. Government promoted soap and water, but they didn't promote. All the alcohol from the pubs and bars went into the this kind of sanitizers and all that. Since it was not used, the pubs and bars are closed. This
every 5 minutes, people डर की वजह से they were height. Sir, even today I feel like laughing. People have washed vegetables also, with these things. Like madness, people were doing things. So this was causing harm to them. So I
this
just
was
felt
a madness thing. I tell you, we have a pub nearby at our house. That's a downtown, and they sell fresh beer. Which is fresh beer. The hotel went it out. Whatever their production was going on, but they now packed it into bottle of sanitizers. So all the alcohol was sold like sanitizer. That is what it is. And you keep on applying alcohol over a period of time, it will be a kind of a mishap only.
True. And sir, you talked about mask. So do you really recommend this number of hours of mask that was in protocol that was being used? For hours together, even small children. I was worried about more patients, who were having COPDs, like, asthmas, and already with decongested nose, you're having symptoms and you're asked to use mask. So how you will deal with such things? Like what you will tell?
See, the mask was not advised at home. Mask was advised when you go in public and when the interperson distance is less than a meter. So you are prescribed a mask in public settings only. Not you sit alone in your room and apply the mask and you think that at the 9th floor of your building or society the coronavirus will jump up to you and come to the 9th floor and enter your nose. It was not like that. Now people using it like crazy. Sanitizer crazy, mask crazy, soap water crazy, kada crazy, stimulation crazy. Kada was again one thing. Kada was again producing that kind of spice burn, what can be called as, because they used to make it more and more concentrated in the hope that this kind of a pungent kind of a taste would destroy the virus. Actually, it destroyed the virus also, but it destroyed your local flora also, and you end up having another kind of infection.
The good flora. मैंने इन सेशंस पे आयुर्वेदाचार्य डॉक्टर्स, अलग होम्योपैथी नेचुरोपैथ्स को भी बुलाया. उन्होंने भी अवेयरनेस क्रिएट किया कि काढ़ा एंड ऑल दैट यू आर सेइंग कि इसका कैसा ओवर यूज हुआ. गूगल पे पढ़ के लोगों ने लिया है. सो ये बहुत गलत चीजें थी. तो इन सब चर्चा से मुझे ऐसा लगता है कि हम लोग लोगों तक करेक्ट मैसेज पहुंचाना चाहते हैं इन सेशंस से. तो लोगों को समझे कि रियली क्या करना चाहिए, किस हद तक करना चाहिए, एंड नॉट ओवरडू इट। तो यही मोटिव है ये सेशंस करने का। और सर एक सिर्फ चीज मैं थोड़ा ऐड करूंगी। नाउ आवर टॉपिक इज मोस्टली ओवर रिगार्डिंग ईएनटी एज सच। तो मैं एक एज अ डॉक्टर करके मुझे आपसे ये बात करनी है कि हैव यू हर्ड अबाउट दिस पैंडेमिक ट्रीटी कि जो अभी बहुत चर्चे में है?
I have heard only. I have not gone to it because मुझे मतलब मेरा जो niche है उसमें it look not so productive for me. The narrative is it is not so much useful to me. I am a practitioner and I find value in creating solutions for the actual problems of the patient. So this treaty I have heard of, but actually I am really not aware of. Sorry for that.
सर हम लोग ऐसा ही बोलते हैं कि आई एम अ प्रैक्टिशनर। अभी मैं भी खुद आई एम होम्योपैथिक कंसल्टेंट। तो हमें बहुत बार ऐसा लगता है कि दिस इज नॉट गोइंग टू अफेक्ट अस ऑन डे टू डे बेसिस ऑफ प्रैक्टिस, लेकिन मैं खुद आई हैव बेयर बोन द ब्रंट। मेरे जैसे हु आर फ्रॉम सो कॉल्ड, लोग बोलते हैं कि यू आर नॉट एन एलोपैथ। So yes, we are homeopaths, we are Ayurvedic people, and we were not asked to take certain cases during pandemic and all. तो ये तभी समझ में आता है कि कुछ चीजें कितनी मायने रखती हैं एज अ डॉक्टर। तो ये जब पैंडेमिक ट्रीटी की बात होती है, अभी मई में दे आर थिंकिंग दैट दिस पैंडेमिक ट्रीटी विल हैपन अक्रॉस ऑल कंट्रीज एंड WHO इज ट्राइंग टू लेट आस्क ऑल कंट्रीज कि ये साइन होना चाहिए पैंडेमिक ट्रीटी। और इस ट्रीटी में दे हैव मेड चेंजेस टू इंटरनेशनल हेल्थ रेगुलेशंस ऑल्सो, बहुत सारे अमेंडमेंट्स किए गए हैं। तो इसका इफेक्ट कहीं ना कहीं तो डाउन ग्रास रूट लेवल डॉक्टर्स पे होता ही है, ऐसा मेरा मानना है। अभी ये 2-3 साल से तो मेरा यही मानना है, इसलिए मैं ये टॉपिक पे डॉक्टर्स से चर्चा करती हूँ कि आज हमें ऐसा लगता है कि इट माइट नॉट अफेक्ट, लेकिन कल जाके और कुछ डिजीज आए और कुछ प्रोटोकॉल्स आए, तो हाउ वी एज प्रैक्टिशनर्स हमको क्या इफेक्ट कर सकता है। और तभी हम अगर कुछ चीजें हमें नहीं we feel that it's not correct and this is not that should have occurred, तो तभी हम कुछ कर सकेंगे क्या? ऐसे सवाल मेरे मन में आते हैं as a doctor. So forget about I being a homeopath or you being an ENT. In pandemic even you faced certain things, isn't it, as a doctor? So ऐसा लगता है कि ये सब चीजों को अगर सही तरीके से नहीं हुआ देन व्हाट, ऐसा मेरा आपसे क्वेश्चन है कि कभी आपने इस एंगल से सोचा है कि व्हाट कैन हैपन एंड व्हाट कैन वी एज डॉक्टर्स शुड डू एंड कैन डू टू मेक सम चेंज इन सिस्टम?
Ma'am, definitely I see false or not so true information propagating in the common population, people finding interpretation of themselves. एक पैराग्राफ मैं पढ़ूंगा, आप कुछ इंटरप्रेट करोगे, मैं कुछ इंटरप्रेट करूंगा। गाइडलाइंस जो है वो चेंज होती रहेंगी। 1.5 साल में गाइडलाइंस ही चेंज होती रही, आज ये गाइडलाइन कल वो गाइडलाइन। एंड WHO शुड हैव बीन ऑनेस्ट कि मेरे पास अभी ये गाइडलाइन है कि ये चेंज हो सकती है, क्योंकि द रिवर्सल ऑफ गाइडलाइन वाज ऑलवेज देयर। And it is true. Now see, with the time, we become wiser. We become wiser. The common population become wiser. Some people become extra wiser. It is not that COVID cannot kill a patient. Any infection can kill a patient. Exactly. The importance should be on the holistic health, and this is proven. People with predisposed conditions of low immunity or morbid condition, they went into trouble more, and they went to the crematorium also. So it is the overall health of the patient. It's an infectious country. No country is now free from infection. Now US is also an infectious country. They also had a load. Infection has no boundaries. Infection has no racial discrimination. Infection can be anywhere. New infection, havoc was there, and of course, once you have a dictatorship, because we may be a socialist republic country, but the lockdown was imposed like a dictatorship. It is
Exactly.
true. There was actually the policy decision makers were the bureaucrats. The doctors were really not much except to give the guideline what was given by the government, and
Right.
government has given कि भैया ये बोलना है. Even to the best doctors sitting in the apex bodies, be it AIMS or Delhi or GTB, whatever it is, they used to speak the same language of the government, and of
Hmm.
course modify themselves also. Now, because that's not their word of mouth, it's a policy decision that has been there. Now,
Hmm.
over exaggerating things, the economy getting down, of course, the mental health of the patient getting down. The it was a kind of a mental accident which happened during this time, and people became psychogenically not so well as they were before. And
True.
today also, now people have started saying, "Upar jana to Bhagwan ki marzi hai." It is not true. Nobody can कोई सीधे ऊपर जा ही सकता except for suicide and all that. One person's have the good health and of course the good body structure. Exercise is a it's a generalized thing. You exercise, you eat good, and you eat less. The less you eat, the less you will eat medicine. The more you eat food, the more you will eat medicine. The more you exercise, less will be the medicine. These are universal principles that have been for long means from our uh, ancestral point of view. The activity is the best thing. Eating a balanced diet. Now, eating a balanced diet is not equal to eating everything,
Hmm.
as per your thing. People should understand what they are spending, how much energy they are spending, how much they are eating. The balance should be there. This balance does not have. This is a daily affair. If we eat lunch, breakfast, dinner, how many of them calculate what we are eating is appropriate to our activity, or we are eating, more than that? So it is true, but our treaties should be there so that in future, if any condition like this is there, there should be something of a hold that the particular entity of the uh, thing should have a upper hand. See, if it is a war, then the defense minister also has the upper hand. He is on the forefront. Prime Minister cannot guide him ki ye kar wo kar. If
Hmm.
it is a kind of a tribal problem or something like that, that social justice ministry has to be there. If it is a health problem, then health minister has to be there. And if he is actually a reputed doctor, then of course okay. If he is not a reputed doctor, definitely he should have this team of doctors which have an equal right to say and all that. So we
Hmm.
were actually following WHO in this, and WHO was following something which
Hello. Hmm. Yes.
So this kind of treaty between countries and all that, passing of false information, most of the information came from China was actually false. The visuals were false. The brutality was false. It is now clear. But that false videos and all that, they have created significant impact in the minds of local population. The
Hmm.
intelligent person can find out which is false video, which is but the general population cannot find out. The general population will have
They will believe in
you
what they
see
see.
something they will believe. What will be seen will be sold out to the brain.
Exactly.
Now the brain will buy and keep it for life now. That is how it is. जो दिखेगा
Hmm.
वो बिकेगा, and that will create an impact. Every industry is running on this only. Amazon is running on this. दिखाएगा बिकाएगा, and that is how it is. And same with the our health industry also.
Right. सर, आप जाते जाते अगर एक एडवाइस देना हो आपको, एक एडवाइस पब्लिक को, एक एडवाइस कलीग दैट इज डॉक्टर को, और एक एडवाइस पॉलिसी मेकर को, तो आप एक एक एडवाइस सबको क्या देंगे?
So see, for common population means a common man, common woman, or anybody who is actually in a different stream, working office going person or a self-employed. See, what is in his control is in his control is to take proper advice. take all the knowledge, Google and all that, without fear, because he is not giving knowledge to you. He is extracting his knowledge and presenting it to you. What you are taking, he is not aware of. ChatGPT is not aware of. So a personalized, customized, tailor-made advice is something which we should look for. Finances is really not a problem for anybody कि हेल्थ के लिए लोग या तो लाख रुपए खर्च करते हैं, कंसल्टेशन के लिए लोग सोचते हैं कि यार क्यों करते हैं. The mentality is very clear. Patient says कि कंसल्टेशन क्यों देनी, मैं ऐसी दवाई ले लेता हूँ, मैं ऐसी किसी लोकल प्रैक्टिशनर से नॉन आरएम की दवाई ले लेता हूँ. बट कुछ लोग कंसल्टेशन के लिए दे थिंक दैट कि मुझे कंसल्ट क्यों करना, वो क्या बताएगा, मैं गूगल से ढूंढ लूंगा, गूगल से अपना इंटरप्रेट कर लूंगा. एंड टेकीज डू इट वेरी ऑफन. और टेकीज प्रॉब्लम में ही आते हैं, या तो कुछ नहीं खर्च करेंगे या फिर दे विल लैंड अप इनटू मोर एंड मोर एक्सपेंसिव काइंड ऑफ थिंग. सो दिस इज द एडवाइस यू हैव. आप अपनी गाड़ी खुद ही ठीक कर सकते हैं, अपना एसी खुद ही ठीक कर सकते हैं, अपना मोबाइल भी आप खुद ही ठीक कर सकते हैं. तो हेल्थ के बारे में यू कंसल्ट समवन हु इज responsible and what you think you are connected.
Right.
For policy makers, definitely, I really cannot advise. They are our bosses, and they should actually go by.
You are saying this, but but I will say that this is a big statement. We should not say like that they are our bosses, because it's affecting, these policies affect us as an individual, as a professional, in many ways, I feel. So it's a big responsibility, I feel, in fact, on these policymakers, and they should really think about what the general population wants from them. In fact, that is what I feel.
See, the day when it will come, like qualified professional becomes politician, then of course this question becomes very relevant. See, if the policy is going in the hand of a 10th class pass, or a person who has even done his MBBS through a payment quota seat, or there are many other ways also. Not pointing to anyone, with due respect to everybody. But the qualified thing is the time. No, you won't, and you won't go into politics. Even I won't. What is our discussion? I am a daily wager, you are a daily wager, or you are a monthly wager, and this politics is dirty. But this politics is not dirty. This is running our country.
So don't you think that medical professionals should really, think of contributing in this policy making, or, into politics? Because last session I had with a doctor, so we were discussing the same thing, कि how nowadays है कि ऐसा लगता है कि doctors ने भी इसमें you should go into the system if you really want to change the system. आपका क्या ख्याल है?
Lot of doctors are coming into politics, and of course with our good luck, the few of the health minister have been good doctors in administration. They recognize the emotions of the common public population. They have seen the pains and all that, and of course it is true they will purify the system. I think so, at least on our health part. Other part I will not touch finances or defense and all that. So,
I just feel that doctors should enter into politics not for the sake of politics but for health, in true sense.
Yeah. In true sense, actually, I can quote examples of my friends, my ENT friends who are in politics actually, and the biasness is there. You have to join a party for that. You cannot be an independent candidate, but people are there. But despite of the fact they are working in a party, but they will say it right, even if the party has an objection. No, this is not the way, but they will say it right. I have seen doctors are very honest people. On an honesty scale, they are the most honest people on this earth, which we think so. The Indian scenario has become a doctor, anti-doctor kind of a thing, just because of the easy availability, and just because of anybody can say anything. There should be a law on saying also. democratic republic, secular country does not mean that you will, point and use bad language for anybody or everybody. That using a written complaint or using a written kind of a complaint is, of course, grievance or something like grievance, negligence, whatever you call it, is okay. But you shout in and create a scene, and of course, it is visible to everybody that he's slapping a doctor, he's abusing a doctor. See, these things are quite common in public. See, abuse is always there. Abuse is in a cinema hall, abuse is in a hotel. But why do this video of doctors being slapped or violence in hospitals keeps for a long time on the media?
Yes.
Who is getting harmed? Patients are getting harmed. Doctors were service providers. Government made them shopkeepers. Now the Consumer Act. Service has gone. We are a product. See, the product is not so important than the process. Why we have become doctors is to allay something. If there is a prejudice in allaying something, our purpose is lost. Now the purpose that we have to behave as good shopkeeper. We have to behave like a vendor. We have to only deliver products. We don't have to deliver service. Service has gone long before. Our product is there. And even product is not important. The important.
Sir, and what advice you will give to a physician or other your colleague or doctors in general? Hello? हेलो डॉक्टर रवि, हम लोग इस पे चर्चा कर रहे हैं एंड आई एम ट्राइंग टू आस्क डॉक्टर रविकांत सिंह कि उनके एडवाइसेस क्या है जनरल पब्लिक के लिए, डॉक्टर के लिए एंड पॉलिसी मेकर्स के लिए. तो लेट्स सी व्हाट ही हैज एनी एडवाइस फॉर डॉक्टर कलीग्स. Meenakshi, I think till then we will just scroll the website. तो सभी को मालूम पड़े कि यूएचओ की वेबसाइट दिखाएंगे तब तक. सर, आई थिंक नेटवर्क लॉस हुआ है सर का. यूएचओ की वेबसाइट लिंक कैन यू जस्ट शेयर? यस, मैं सभी को बता दूं जब तक सर कनेक्ट नहीं होते फिर से कि ये जब सेशंस में सब कर रही हूं तो ये यूनिवर्सल हेल्थ ऑर्गेनाइजेशन और अवेकन इंडिया मूवमेंट के साथ कर रही हूं. ये हमारी वेबसाइट है और हम फिलहाल ही में एज अ ट्रस्ट रजिस्टर हुए हैं. सो प्लीज रिक्वेस्ट टू पब्लिक कि आप वेबसाइट पे जाके यहाँ का कंटेंट देखिए. बहुत सारे आर्टिकल्स लिखे हुए हैं एंड कंसर्न टॉपिक्स पे आपको आर्टिकल्स मिलेंगे, न्यूज़लेटर्स मिलेंगे जो हर वीक हम प्रोड्यूस कर रहे हैं. एंड यू प्लीज बिकम अ मेंबर ऑफ यूएचओ एज वेल. और अवेकन इंडिया मूवमेंट के भी वेबसाइट पे आप जाके कंटेंट्स देख सकते हैं. सो इट्स अ रियल रिक्वेस्ट दैट कि आप यू बिकम अ मेंबर ऑफ यूएचओ. इट्स अ हेल्थ ऑर्गेनाइजेशन एंड गिव अस फीडबैक्स एज वेल. ये जब सेशंस आप देखेंगे तो प्लीज आप कमेंट बॉक्स में या मेरा नंबर भी फ्लायर पे रहता है, आप कांटेक्ट करके फीडबैक दे सकते हैं रिगार्डिंग दीज सेशंस. कि अगर आपको कुछ सजेस्ट करना है कि सेशंस और किस तरीके से हम ज्यादा अच्छे तरीके से कर सकते हैं तो प्लीज ट्राई टू गिव फीडबैक. डॉक्टर रविकांत सर ज्वाइन हुए हैं क्या फिर से? I think he may not connect now because it's already 5:23. So I think we can end the session today here. आज सर के साथ बहुत चर्चा हुई है regarding allergies and in general कोविड के विषय को भी मैंने बीच में लाया because he was ENT specialist. तो मैं खुद को रोक नहीं पाई to ask certain questions regarding COVID virus and everything. तो प्लीज आप हमारे सेशंस रेगुलरली देखते रहिए एंड फीडबैक देखते रहिए. सो वी विल मीट नेक्स्ट फ्राइडे विद अ न्यू डॉक्टर विद अ न्यू टॉपिक. So have a very good day and thank you.
Bholanatha's brush cutter is a battery-operated machine with a charging time of 3.5 hours, boasts an impressive operating time of 6 to 8 hours, allowing it to efficiently cut through 16,000 square feet of wheat or rice fields on a single charge, while its petrol counterpart consumes 1,000 Indian rupees worth of petrol for the same task.